Hello, welcome to Sleep Unplugged with Dr. Chris Winter. I'm Dr. Chris Winter. You're listening to episode 13, Restless Legs Syndrome. You Gotta Move. You Gotta Move was an old blues song that was recorded by the Rolling Stones on their 1971 album, Sticky Fingers, which is one of my favorite Stones albums. It's the one with the classic Andy Warhol cover shot of the front of the tight jeans that initial albums had the zipper that opened up. Later albums did it because it actually scratched the record. I always liked the song "You Gotta Move." It wasn't written by Rolling Stones, actually written by Fred McDowell and blind Gary Davis, who were not credited earlier on in initial pressings of the album, but later on were credited. Love the album, love the song, You Gotta Move, and it's a perfect theme song for our discussion today about restless leg syndrome, which I'm excited to dive into. First things first, my socials. If you want to follow me or get more information about this episode and subsequent episodes, you can follow me on Dr. Chris Winter on Twitter, Dr. Chris Winter Instagram, Dr. Chris Winter TikTok. And if you want to jump right to it, if you use the hashtag Sleep Unplugged Extras, all run together, that's generally what I tag extra content or content that sort of builds upon what we've talked about in these previous episodes. Usually start off with corrections. The only correction that I've really found from the last episode on sleep and athletic performance, it's relatively inconsequential, and I covered it in one of the sleep extras that I posted online. When I was mentioning the research we were doing about circadian advantage in the last episode, I talked about if teams went east to west, that was a positive movement. If they went west to east, it was negative. We actually used the reverse. And I actually posted a little screenshot from our spreadsheet looking at that data, and you can kind of follow along the code: A for away, H for home. Then there's a positive or negative number indicating where the visiting team is, positive, negative number visiting the home team is, and then whether they a W or an L, win or lose. So I think that's it. We generally do a letter. And once again, I'm going to break convention and do two communications that I had between last week and this week. The first is from somebody named, their name is irrelevant. I did a posting on Precision Nutrition. Disclosure, I do have a financial relationship with Precision Nutrition. I've done some posts for them, but I really believe in their mission and think they're awesome people. If you want more information about nutrition, that's the place to be. So I posted something about the most common misperceptions related to sleep. And my misperception was that people can't sleep. And if you want more information about that, you can tune into episode 2 of the podcast, which is titled Insomnia, What It's Not. And what it's not is an inability to sleep. But anyway, in it, this individual wrote, rolling my eyes right now as I struggle with insomnia and going back to sleep. If you wake up, go back to sleep. Question. Oh my God, I can't with this guy. And this guy being me. And I'm sorry that post upset you, but I want you to contrast that post with a really lovely message I got around the same time about the same thing, which was from somebody named Queens of Hackney on Instagram. Just wanted to give you a huge thank you. Reading your book, The Sleep Solutions, helped me resolve my sleeping issues. I only had to get halfway through the book to start sleeping well. It changed my life. Little thing, prayer hands. The concept of sleep quality misperception in particular was the turning point for me. So empowering to be able to do again something as natural as sleeping. Makes me feel less broken overall. Not taking sleep meds was a big goal of mine. Literally dropped them so easily, and that alone makes me so happy. I worked on my day schedule for a couple of months before reading your book, and I think that's helped as well. Learning in depth about the circadian rhythm is very freeing. Knowledge is power. And I tweeted this week, the definition of a hack is an individual who wants to fix something but doesn't want the knowledge. That's what hacking is, in my opinion. That's my definition of it. And I think it's so interesting that the last thing that Queens of Hackney said was knowledge is power. And I hope that initial commenter, who I really feel for, can find some source of knowledge that can help her understand that she too can get out from under her sleep. So if you're interested in more definitions about insomnia, episode 2. She also mentioned dropping sleeping pills, and we covered sleeping pills big time in episode 10. So we're working our way through the topics and really excited to be doing that. So I appreciate the conversation and all the comments. I should also mention that we do have a YouTube channel. If you type in Sleep Unplugged in YouTube, you can find my channel with all of the episodes posted there, and obviously all of it's for free. So you got to move. Restless Legs Syndrome, originally described by Sir Thomas Willis in 1672. And if you're an anatomy buff or you have your phone in your hand, you can type in Sir Thomas Willis. You can also type in Circle of Willis. So if you're a neurologist, as I am, or somebody who studies brain anatomy, or a cognitive science major somewhere, and you're interested in the anatomy of the brain, there's something called the Circle of Willis, which is this ring of blood vessels, very important in the brain because it's the confluence of a lot of blood vessels that feed the brain. And this guy discovered it and named it Circle of Willis. So not only is he sitting here dissecting brains and looking at this, but he's coming up with these really interesting ideas about sleep and this particular sleep disorder. So he figured out that there was this disruption that individuals that he was studying were having with their sleep, but it related to unusual leg movements. So he originally published it in Latin in 1672, translated. It says, I'm going to read the words of Sir Thomas Willis. Wherefore to some, when being in bed, they betake themselves to sleep, presently in the arms and legs, leapings and contractions on the tendons, and so great a restlessness and tossings of other members ensue, that the diseased are no more able to sleep than if they were in a place of the greatest torture. I love that quotation. And the great thing about it was he discovers this, he writes about it, he sends it out into the world, and nobody cared. It's silent. Nobody did anything about it. Nobody discussed it. It just disappeared until 1945, when a doctor, Carl Axel, so his first name is hyphenated, Ekbom, Ekbom. He was a Swedish neurologist, yay for neurology. He rediscovered it and said, oh, there's this interesting thing that happens where individuals have these dancing legs, and it makes it very difficult for them to sleep. And once again, despite his publishing on the subject, and there were others who published as well in between Willis and Ekbom, it just was completely ignored. Until finally in the 80s, there was a Vanderbilt neurologist, Arthur Walters, who wrote about it and said, hey, there's a lot of people out there who are struggling with their sleep because of this disorder. So Restless Leg was born. And at this point in the 80s, it finally stuck. Although if you look it up, there's still a lot of controversy about this drug. There's still this kind of belief that it's over popularized, that it was a manufactured disease state of pharmaceuticals. They were basically selling a drug to treat a disease that didn't exist. It was a massive emperor's new clothing sort of situation. We'll create a disorder and make doctors feel like everybody has it, and we'll sell a whole bunch of medications. And there was even a Saturday Night Live sketch. I don't know if this will make my podcast episode adult or explicit, but it was about restless penis syndrome. So there was this sort of reaction to the disorder when it became popularized that it wasn't real or it wasn't serious. And trust me when I say this, nothing could be more serious than this disorder. If you talk to people who truly have restless leg syndrome, it is misery defined. And so let me paint a picture for what restless leg is. Restless leg, imagine difficult day, stressful day, finally gotten home, gonna relax on a Sunday evening, watch a little House of the Dragon, have a little something to eat, a soda water, whatever you like to relax with, a kombucha at night. And as you sit down to watch the show, you start to begin to feel this uneasiness, tickle, itching, deep, deep seated discomfort in your leg. Is it painful? Not really. Is it a cramp? No, it's not that. These are the kinds of questions that doctors often ask patients when they go to see them based upon these symptoms. And it is incredibly difficult to describe. And our vocabulary as physicians often is somewhat limited. So as you go into your doctor and say, I've got this thing going on in my legs when I go to bed at night, and the doctor says, oh, you're having cramps like Charlie horses. No, it's not really like cramp, doc. Oh, is it painful? Like you've got lightning going down your legs, or there's a nail going through your kneecap? No, it's not like that at all. It's really not that painful. After a few questions and probings, your doctor's probably very likely to lose interest in the whole thing. And because of that, it becomes very difficult for these individuals to get the treatment they want. In fact, when you look at the early studies of dopamine agonists, so this is a class of drug that is actually used to treat restless leg. What was shocking about the research when you looked at it was just how good the placebo arm did in these studies versus the experimental arm, meaning that there were a lot of people who, if they were randomized to get placebo instead of the active drug, did quite well. And as we've looked back on these studies, it became very clear that a couple of things are happening. One, there's a strong psychological component to the condition. Number two, this was often the first time these individuals were ever talking about or dealt with in terms of the restless leg, meaning that imagine you've got this weird condition, you've never really talked to anybody about it, you might not even recognize it that much yourself. You're sitting in a doctor's office and there is a sign that says, do you ever feel unusual symptoms when you sit down at night? Like there's bugs crawling in your legs? Da, 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 da. Do you feel like a lightning bolt? It's hard to sit still. It affects your sleep. If so, call this number. So for a lot of people in these studies, this was the first time they were ever diagnosed. So imagine being in a migraine study with migraine drugs or placebos in this randomized controlled study, but you had no idea, you'd never been diagnosed with migraine before. That's never going to happen. As soon as you have your first migraine, you know you have your first migraine. So it was a very unusual patient population. So restless leg is fairly common. We see a lot of it in sleep clinics. We diagnose and treat a lot of it. Probably affects somewhere between 2 to 15% of the population. That's a difficult number because it often it's a big variation because there are a lot of people who have it but don't necessarily treat it or find it to be particularly serious or worthy of seeing a doctor. For other people, it's very much not the case. I personally have it every now and then. It's very mild. I remember having it when I was younger. And it's interesting when you talk to a lot of people with restless leg, they'll tell you very interesting things. I have it when I sit in this chair, but if I stretch out on the couch next to it, I don't. I always felt personally that wearing something like blue jeans in the evening made me uncomfortable. But if I just took them off and sat there in my boxers when I was a kid or stretched out on the floor, I felt a lot better. I had a young woman tell me that knitting was very helpful to her, or putting her legs up in a certain position. I had another woman who went to bed with belts around her leg, these little Mayan belts she'd gotten in Mexico, and she would just kind of strap them around her leg. So for a lot of people with restless leg, they like some degree of pressure on their legs to kind of make their legs feel a little bit better. But there's lots of people out there who have it. So what is it? Well, we can define it pretty clearly. So the diagnostic criteria are very simple. And one thing I very much want to stress is you do not have to have a sleep study to diagnose restless leg. So when somebody comes to a doctor and says, I think I have restless leg, we ask a few questions. The first is, tell us what you feel. Well, it's this weird, creepy, crawly, tickly sensation in my legs that really makes it difficult for me to relax or to sleep. The next criteria is, when is it happening? Restless leg generally happens much more in the evening at night than it does during the day. So asking that question, or in a roundabout way, asking people about, what are your naps like compared to your sleep at night? That's often extremely telling, because they'll say, yeah, if I sleep during the day, I feel much better, much more rested than if I sleep at night, because of that circadian nature of the disorder. And when we think about that, it usually affects the first half of the night much more than the second. So, and I'll often ask that in my clinic, split the night in half, what's your better half? By far and away, most restless leg people say it's the second half. When the alarm clock goes off, when it's time for me to go to work, I feel like I was just starting to get some sleep. That's very different from the average sleep apnea patient, where that's reversed. So the first half is a struggle. After 3 or 4 hours, they fall asleep. Next thing they wake up, like, oh, I feel like I just fell asleep. The condition is much worse with inactivity, and it's much better with movement and not explained by something else. So when you sit down to watch the show, it's bad. But if you get up and move around, it almost instantly goes away. So you can imagine the disruption to the evening, or you go to see a basketball game that tips off at 7 o'clock at night, or the red eye flight. To me, you want to find some restless leg people, hop on a red eye flight and stay awake a little while everybody else is sleeping. You can see the restless leg patients, that inability to move. They're strapped into that B or E seat, where you've got two people next to you and you can't move very freely, and both of them are asleep. So you're kind of wedged there and you can't move. When you've got restless leg syndrome and you can't move around, you're kind of forced to sit still. It is awful, maddening. And I've had personal experience with that before. In fact, a long time ago, they used to do a test in the sleep lab to help diagnose restless leg, where we would put you in the sleep lab, hook you all up, get you in bed, but instead of lying flat in the bed, you sat up, and we told you don't move. And you literally had to sit there hooked up for the sleep study, being told not to move, and then you were observed to see how much you moved, because it was very difficult for those people to sit still. So that's what it is. Affects a lot of people, women more than men. And there's sort of two broad categories of it. There is primary and secondary. Primary meaning you just have it, you're born with it. It's a highly hereditary condition. Probably 60% of cases, you can identify other family members who have it. Most of the disease loci that we found on chromosomes are autosomal dominant models. I think there is one that's autosomal recessive, but most are autosomal dominant. So when you find one, you find a lot. And they often have great stories to tell you. Oh yeah, my grandfather had it, and we always said he had the Jimmy legs. Or families will have a name for it. Everybody in the Perkins family got the Perkins legs, or the moving legs, the jumpies. Everybody, they have names for it, and they all can identify one another. So one of the things I always ask patients: has anybody else in your family been diagnosed with restless leg, or take any medications for their sleep? And if they kind of do some investigation, they may find, it's funny, because I just called my sister out in California, and she's taking a medication for her legs that's helping her sleep, called ropinirole. And a lot of times, if it works for sister, it's going to work for your patient. So finding out about family history is not only helpful diagnostically, but it's extremely helpful therapeutically. So that's the primary people, the people who just have it. There is a secondary restless leg, meaning you've got a condition, and that condition is contributing to restless leg. And some of those common are low iron. So we always check iron or ferritin levels. And we always look for ferritin levels less than 50. I was always taught in fellowship less than 100. Early in my career, I just found no utility in treating those individuals who had ferritin levels between 50 and 100. I'm sure somebody out there would say, no, it's not true. I've had patients who've responded to it, but I just had so many treatment failures of giving iron to people who were in that 50, 100 that we really just kind of look for below 50. But we always have the conversation. If somebody has a ferritin of 70 and they really want to get an iron infusion, then we can do it. And I will say this: so ferritin is a measure of iron stores in the body. If it's low, that can be a therapeutic option for patients. It's important. I see a lot of patients get diagnosed with restless leg. They have low ferritin and they're put on oral iron. And in my experience, oral iron does virtually nothing. I mean, I've got somebody who comes in, their ferritin level 7. And they get put on oral iron because, believe me, I did it when I was young in my career. 3 months later, they come back, their ferritin level is 20. So we've been working for 6 months and we've been giving you this iron that makes you constipated as hell, and your ferritin level went up like 3 points. So the using oral iron is okay. I think it's much better once you've gotten somebody's iron level up, using that oral iron to maybe keep it from declining as quickly, because it often does. So the oral iron also doesn't make a lot of sense, because I was talking to a hematologist one time. It's one of the most common reason why your patient is probably going to have low iron is because they don't absorb iron very well. So you're just giving them more iron to absorb poorly when you give it to them through their gut. So what we often do is give an IV infusion of iron, and that often helps people tremendously. And believe me, we have got some massive home run stories with that. Diagnose an individual who's got terrible, restless legs. Check their ferritin, it's 3. Give them oral iron. 3 days later, they got a ferritin of 150, and it can be a radical change for some people. In fact, my favorite story is a woman who, that's exactly what happened. Terrible restless leg, terrible sleep, low iron, gave her ferritin, gave her IV iron, and changed her life. And then, about 6 months or 9 months later, a year later, she went to her primary care doctor and said, I think my iron level's low, my restless leg's coming back. And the primary care doctor said, no, it's not. You just had you just had an iron infusion. It wouldn't drop that quickly. And she said, well, can we just test it? And he said, no. Look, baffles me. You're going to go out on that limb. You're going to say to a patient, no, you cannot, we're not checking your iron level. Why? Why would anybody ever do this? So she called me up and said, hey, Chris, I didn't want to bother you with this because I've been doing so well. I didn't really need to see you. But she explained the story. I was like, well, sure, I'll check a ferritin level. Yeah, I'm curious. And sure enough, I think her ferritin level had been like 7 when I saw her. We did the IV infusion. It was, we got it up to like almost 170 or something is in my head. And when we saw her and checked her ferritin, it was 43 or 37. So you can sort of track it up. She was very, very low and then very high, was doing great. And then despite the fact we had her on oral iron, over the next several months, she had descended back down to a level that was getting low again. And she could feel it. So we infused her again and she went back. And this time it's lasted longer. I don't know why, but anyway, always want to trust our patients there. But low iron can do it. Kidney failure is by far and away the worst cases that I've ever seen. Individual has failing kidneys on dialysis. It can be an absolute. I mean, I think we saw one woman on kidney failure, kicked her leg something like 1,000 times during the night. Now, that's periodic limb movement. We'll talk about that in a different episode, but it's often related to restless leg. I mean, this woman was so restless. She didn't stop moving really when she was awake and barely stopped moving when she was asleep. Parkinson's disease, although it only really works in one direction, meaning that if you have Parkinson's disease, you're very likely to have restless leg syndrome. I'm not sure that it's ever been definitively proven that if you have restless leg syndrome, your risk for Parkinson's disease is dramatically higher than the general population. And the reason for that is the underlying pathophysiology of restless leg syndrome has to do with dopamine and iron synthesis, perhaps. But dopamine is involved, or iron synthesis is iron is involved in dopamine synthesis. So when you look at Parkinson's disease, the cells of this little structure called the substantia nigra die, and they're the cells that make dopamine. So in Parkinson's disease, you have a total loss of dopamine because the cells that make it die. In restless leg, you're making dopamine, but you're making it in a funny pattern. Dopamine levels should be high during the day and lower at night. For restless leg patients, it drops too low. So that natural drop we have in dopamine, because dopamine stimulates wakefulness, we want a drop in dopamine as day goes to night. But for patients with restless leg, that drop becomes too considerable and they drop below the threshold that allows that dopamine to keep our bodies still. So when you look at, I always remember watching, if you look at Michael J. Fox in an interview, God bless that guy, diagnosed with Parkinson's disease at a very young age. And one of the things that's very striking when you watch him interview, depending on how he's being treated or where he is in his Parkinson's cycle, is he has sort of, and if you're watching on YouTube, you can see it, but if you're listening to me, he just has a sense that it looks like he's wanting to move and not able to control it. It's a symptom called akathisia. And it's really what our bodies want to do all the time. Everybody's got akathisia. If you look at little kids, and they're sitting there in, I don't know, like a church service or someplace where you're supposed to be still, and they're moving around, sitting on their mom, and they just can't sit still. They've not really developed the parts of their nervous system that allow them to control that. So our bodies don't necessarily want to do it, but some of those dopaminergic systems in our brain allow that to happen. When those are removed, either because you lose the cells like Michael J. Fox has lost in Parkinson's disease, or you're secreting temporarily dopamine at a lower level than you should, it releases us and makes us feel that internal urge to move. And for most people, it's primarily in their legs, therefore restless leg syndrome. It can be in other parts of the body, particularly in people's arms. They'll often describe it. And again, it's just a terrible feeling. Other things that can cause it, pregnancy. A lot of women have restless leg syndrome sort of only when they're pregnant because of changes in iron and ferritin levels during pregnancy. I always feel like the baby's is sitting there stealing all mom's iron as he or she's developing inside. Celiac disease, some other interesting things I've seen. I saw it one time in a young woman who fell off a horse and shattered her left leg. It was all pinned back together and massive rehab, but she got back on her feet literally, but was left with debilitating restless leg just on the side of her trauma. We've also seen that in individuals with knee replacements and reconstructions, also neuropathy as well too. Many medications can do it. Interestingly, antidepressants, some antipsychotics, particularly that manipulate dopamine, and even antihistamines, which is kind of funny because a lot of times patients go to their doctor and say, I can't sleep. And that's the most likely thing that a patient with a restless leg will tell their doctor, not that I have restless leg. That's very rare. It's usually I can't sleep, I have insomnia. And so a lot of doctors are like, well, just take some Tylenol PM or Simply Sleep or something that's, an antihistamine. And therefore they actually take a drug and make the condition worse. So when do we see them? These people come in, they can't sleep. One of the questions I often ask people when I'm wondering if they might have restless leg syndrome is, hey, when you go to the dentist and they put that lead apron on you, how does that make you feel? And for a lot of patients with restless leg, they will tell you feeling that weight pushed down their body is extremely peaceful to them. And we talked about the woman I was talking about earlier who uses the belts around her legs to fall asleep. I had another woman who said, I love to sleep with my husband literally lying on my legs. And another guy who said, my dream, he said, I don't do it, but I just think about all the time lying down on the box spring of my bed, and then my wife putting the mattress on top of me fully, and then she just sleeps on top of the mattress, and I'm sandwiched between the box spring and the mattress. So this feeling of I want weight on me can be extremely helpful for patients with restless legs. So I'm not aware of any studies specifically looking at weighted blankets with restless leg, but sort of within the sleep community, there's a lot of individuals who feel like, hey, these studies work probably because of sort of the deep touch that they stimulate. Why, if the baby's crying, what do? You swaddle it. Well, that seems kind of strange, but not really. If you think about, we have inside of our nervous system this calming response to pressure. Somebody's sitting there crying, you want to make them feel better. What do? You can pat them on their back. If you really want to make them feel better, you reach up, put your arms around them and squeeze. Well, why do we do that? That seems kind of strange. Well, we squeeze because that tightness makes people feel much better. And I personally have a weighted blanket. And on the rare occasions when I get into bed and think, ooh, I've got some restless leg tonight, I will just leave. I go to the guest bedroom where I keep the weighted blanket and put it on top of me. And it's amazing. I mean, it just feels so much better because that's often what I want. And I remember even as a kid, I would try to shove my legs in between the cushion of the couch and the back of the couch when I was watching TV. Like that felt good to me, or putting my arms in that same spot, just kind of having them squeezed in there. Or if you've ever gotten in one of those massage chairs where your arms kind of fit in the side of it and your legs fit in these two grooves. And I mean, I think that a lot of people with restless leg probably own those kinds of chairs. The other thing that restless leg people really like are hot tubs. That's another question I always ask patients. Do you have a hot tub? Because a lot of people with RLS will tell you, before I go to bed, I really like a hot, scalding hot bath. And then I get out and try to go to bed because that heat seems to temporarily alleviate the restless leg, which is really interesting to me. How do we typically treat it outside of weighted blankets? There was this pad called Relaxis. I don't think they make it anymore, but there's lots of knockoffs, which was a little pad you put on your bed that went under your legs. And as you slept, it vibrated. And that vibration tended to interrupt the signals of the restlessness going to the brain. For a lot of people, it was very helpful. The problem was it was really expensive. You needed a prescription. It wasn't very well covered by insurance, and it just kind of went under. I've also had patients who get the SCDs, the sequential compression devices. If you ever see somebody in a hospital and they're really in the ICU and they're kind of sedated, they'll have these things wrapped on their legs that every 20 seconds you hear this bzzz, and it's squeezing their legs, and it kind of relaxes. So what's happening is it's trying to squeeze and stimulate blood flow through the legs so you don't get blood clots. Well, somebody figured out that if they got a hold of some of those things and wore them at night, it could make their legs feel a whole lot better. And then also, sometimes people find that supplementation with either magnesium, which is the most common one, sometimes potassium can help some people as well too. So, and there's nothing particularly wrong with those as well. And then we did talk about iron. There are 4 FDA-approved drugs for restless leg, I believe. Ropinirole, Pravapaxol. There's something called Nupro, which is rotigotine. It's in a patch. And then there's also I'm blanking on the 4th. So, I'm sorry about that. What was the 4th? So, and a lot of people often use gabapentin as well, which is not an FDA-approved drug, but there are some people who will often use that medication as well. So those are typically the medications we use. One word of caution that I'll sort of throw out there about restless leg is something we refer to as augmentation and rebound. So those are the most commonly used drugs for restless legs. Some people use Sinemet, which is a drug used for Parkinson's disease. People use opioids, benzodiazepines. Like I said, I mentioned gabapentin, which is an off-label use of the drug. And it's nice to have these kinds of options. But some of the older drugs, particularly benzodiazepines and opioids, but to some degree, the newer ones as well too, if they're not used properly, can make the restless leg significantly worse. And one thing I'll mention about restless leg is I tell patients every day, restless leg is like the stock market. You're going to have bad nights with the restless leg. What we do not want to do is deviate from our treatment plan when you have a bad night. Just like the stock market. Oh no, all of my Tesla stock and Bitcoin has dropped precipitously from yesterday to today. What do? You do not sell everything, you hang on. Because what does history tell us about the stock market? It always goes up. So if you hang in there, things will get better. Now, if things are really bad, you talk to your doctor, maybe you make some medication changes. But the worst patients that I have ever seen in my clinic, there is a pattern. They come seeking help for the restless leg, and the doctor gives them the help. Here is a dopamine agonist and a tiny amount of it. You're going to take it about an hour before you go to bed. There you go. And the patient's doing pretty well for a while. It's really working. And these drugs are almost diagnostic if they work, in addition to being therapeutic. But then a few months later, you have a couple bad nights and you call the doctor. Oh my God, my restless leg really acting up. It's like the medication's not working anymore. You cannot go up on your drug. Because what happens is doctor says, oh, it's not working. Well, why don't you just double it? Okay, well, you know what's going to happen? It's going to work. Now, is it working because you doubled the drug, or is it working because the thing that caused your restless leg to worsen, whatever it was, it went away? Meaning, had you done nothing, would anything have changed? So now you're clipping along for the next month or two at that higher dose, and it happens again. And you call your doctor. What does your doctor do? He says, double that dose or take a little extra. And that keeps going until the doctor doesn't feel comfortable with the increase in that dose. And what do? They send them to me. So, word of caution with restless leg, if you're a provider or if you're a patient, weather the storm. I've asked the following question to my restless leg patients for a decade. If you could go back and take the symptoms you were experiencing before you ever saw a doctor, would you trade how you felt then for how you feel now? The answer has 100% universally always been absolutely yes. Because the symptoms you had then have been made worse, not by what you've done, but by what doctors have done. They didn't understand the situation. And I'll tell you, the worst case I ever saw was a patient who all he did was call the clinic. The doctor didn't see him. The doctor just forwarded to the pharmacy a higher dose of the medication they were on. This individual came in taking 17 times the highest dose of this particular medication than you would typically give for restless leg syndrome. And at that point, cut him loose, saying, I got nothing more for you. So, which is fine. You cut a patient loose, but you created the problem. So the analogy I've always used is like Dr. Frankenstein creating the Frankenstein monster, setting it loose on the world and claiming no responsibility. So when these medications are used properly and diligently, they work. They work for a very long period of time. So if you're out there struggling with restless leg and some of this resonates, find a doctor who knows what she is doing in terms of the treatment of restless leg. Because if you can ally with somebody, you can make the symptoms a whole lot better. So that's it. I want to cut this off before we get to 40 minutes. Again, my socials are Dr. Chris Winter, Twitter, Instagram, and TikTok. My books, The Sleep Solution, Why Your Sleep is Broken, How to Fix It, as well as The Rested Child, Why You're Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help, are both out, and both feature sections on restless leg. I will post on my social media some pictures of bed sheets a patient took pictures of where her husband was so restless at night over the years, he wore holes in all the sheets. And we'll put that up, and including some pictures of Thomas Willis and some other fun stuff. Thank you for being part of this episode. If you have any questions, comments, concerns, please hit me on the DMs, like and follow our podcast. If you have time to write a review, really appreciate it. Appreciate the word of mouth out there. And until we talk again, sleep well.